We've had a mystery on our hands this week.
The scholars of this room are the crew of the mighty ship of the Envisioner.
While in search of an ancient treasure, we are marooned on an island, and a key part of our navigational map went missing.
Of the entire crew, we considered 4 suspects today. You will hear the evidence collected against Dr. Smart and Shipwright Neff. Hi, we are the medical examiners. Dr. Smart needs the supplies in the clinic of the ship. First, we need to treat the most injured and in need. Then we can move on to the other patients. You may be asking, what's going on here? Well, here's the short version.
Captain Thomas was on his ship when there was a storm that came, and the ship crashed into an island, and they lived there for a while until they got the food and materials that they needed to get back out to sea.
I am going to explain the sugar tong splint. First, fold it, mostly in half. Then, make sure on one side that it only goes to the knuckles. On the other side, fold down the excess. Then, take the splint off of the patient and shape to your own arm. Make sure that the C-shaped folds only go 2/3 of the way down. Then, apply to patient and wrap.
I will explain the figure of 8 splint. First, you take your SAM splint and put under the patient's foot, and then you take one side and wrap it around their leg. Then you take the other side and wrap it around the other side, and then seal it tight with some gauze wrap. And that's how you do the figure of 8 splint.
Hi, in Captain's Log number 4, Med, Chief Steward is exhibiting severe symptoms, which are losses of breath, wheezing, and accelerated heart rate. Dr. Smart has concluded that one of her lungs has collapsed. Dr. Smart needs us to help him with the best treatment option.
To build a model lung, you will need these items: 1 plastic cup, 1 cup balloon, 1 straw, 1 small balloon, tape, and clay. Step 1 is to put the small balloon on the straw, then cut a small hole in the bottom of the cup and stick the straw through. The small balloon needs to be on the inside of the cup. Then put the cup balloon on the bottom of the cup and then put the clay around the straw. If you pull the cup balloon, it will fill up with air.
The respiratory system works using the lung model because when you pull down the cup balloon, it acts like a diaphragm, breathing in, and the lungs get pumped with air.
The pneumothorax treatment is when air escapes from the lung through a hole and fills up the area in between the lungs and the chest cavity. The best treatment for this is a needle or a chest tube insertion, and if that doesn't work, you need surgery.
Hi, we're reporters from Envision Academy here to report on engineering.
Captain's Log number 8, Engineering. People have gone missing. We need to build a robot to find them.
We created an MBOT by using teamwork, putting all the right parts in the right places, and working hard. We created it to find Neff and Young and lead them back to the ship. This is what the MBOT looks like.
Captain's Log number 4, Engineering. We are not sure where they are, where their crew members are. We need to program a robot to find them.
We programmed our MBOT by going on the MBlock app and coding it to do the right task to find Neff and Young and lead them back. This is the MBlock app and how we programmed our MBOT.
Captain's Log number 8, Engineering. We know where the crew members are. Now we need to build a truss bridge for the robot to get food for us.
We built a truss bridge by using straws and paper clips and fusing them together. We created the truss bridge to help the MBOT go through rough terrain that it could not go through and to find food. This is the truss bridge.
Hi.
were medical examiners. In log 6, after the storm, Dr. Smart concluded that the crew was experiencing fatigue symptoms linked to the cardiovascular system. So he gave us hearts to dissect and experiment with to learn more about the heart and the crew's symptoms.
How I dissected calf's heart. First, I looked at all the weak spots, then I started to cut them. Then, when it was wide enough, I ripped it apart. Then last, I looked inside and I cut all of the cords.
Blood comes through the vena cava and pumps into the right atrium. In the lungs, the blood receives oxygen and discards carbon dioxide. The blood the blood pumps into the pulmonary veins. From the pulmonary veins, it pumps into the left atrium. From the left atrium, it pumps into the left ventricle. The left ventricle then pumps oxygen-rich blood through the aorta and out into the entire body.
A heart attack happens when your heart stops working properly due to lack of blood to the heart. The heart needs blood to function. Often cholesterol and fat will build up in an artery and create a barrier or clot that regulates or stops the blood flow. This causes the heart to have a breakdown. To prevent a heart attack. When a heart attack happens, you often need quick treatment. A test called electrocardiogram can determine where the damage was done. To prevent a heart attack, the doctor will often prescribe medication and recommend exercise, healthy eating habits, maintaining your weight, and no tobacco.
Captain Slog No. 8. The robot was bringing Neff and Young back to the ship, but Young got bit by a venomous snake.
Neurotoxic affects your nerves and hemotoxic affects your blood. Neurotoxic may cause double vision, difficulty breathing, and you might be really weak. Hemotoxic may cause heart attack or stroke, pain, tingling at bite side, bleeding at bite side, numbness, swelling, and bruising.
When you were bitten by a snake, just remember to call 911, remain calm, and move away from the location. But don't attach a tourniquet. Try cutting the bite off with a sharp tool or knife. And 100% don't try sucking all the venom out with your mouth. Young was bitten by a Malayan pit viper, which has brown spots, a flat head, and can grow up to be 30 feet long. Her symptoms were the bite was swollen, it started to bleed, and it was red.
Hi.
Hi.
We are blood spatter analysts. We needed to analyze the blood from the crime scene. We dropped fake blood from 3 different heights, 12 inches, 30 inches, and 66 inches. We did this by using an eyedropper. When we found out that Neff had a cut on his head, and he bent down to pick up the map that he dropped, his head was precisely 30 inches above the ground, and his head started bleeding. And so when it dropped, it was 30 inches. And I'm going to hand it over to Zab to tell you about the blood splatters.
So this is one for 12 inches. Trial 1 was 10 millimeters, trial 2 was 15 millimeters, and trial 3 was 7 millimeters. The average is 12.4 millimeters. For 30 inches, trial 1 was 10 millimeters, trial 2 was 9 millimeters, and trial 3 was 14 millimeters. The average was 14.7 millimeters. For 66 inches, trial 1 was 17 millimeters, trial 2 was 18 millimeters, and trial 3 was 10 millimeters. I'm going to pass it back. And for the last part of that, things that were found at the blood crime scene, the average for 12 inches, the actual is 12.4, and then 30, 14.7, and lastly 66, 16.5 millimeters.
According to the blood samples that we dropped, they were the same exact ones as the blood splatters found on the crime scene. When we found the average by when
we took all the numbers from 30 inches from trial 1, 2, and 3, we added them all up, and that number we divided by 3. And that is how we got 14.7. We did the same thing to the ones that we did, and we got 14.7. And that is how we know that we got that 30 inches was the height of Neff's head when he dropped them out.
Hi, we are forensic scientists. In Captain's Log number 2, Captain Thomas goes to the ship's kitchen and finds a recipe that treats sunburns. Captain Thomas remembers from his chemistry class that you need an even pH level so that it wouldn't burn or irritate the skin.
The 4 white powders are cream of tartar, powdered sugar, baking soda, and cornstarch. We did this activity by observing, smelling, touching, and using iodine and vinegar on the 4 white powders. We also observe, touch, smell, and use water, iodine, and vinegar on the mystery powder. The mystery powder is cornstarch. Cornstarch is used to treat sunburns.
Cornstarch has an even pH level so that it wouldn't harm or irritate the skin.
Hi,
We're forensic scientists.
and today we're going to be talking about who stole the ancient map.
On Captain's Log number 2 CSI, there was a storm that resulted in many people getting injured.
After that, the captain found cornstarch and blood splatter in the room where the ancient map was hidden.
Miss Young saw Neff and a mysterious person sharing a paper. At the scene of the crime, there was a cup with unknown fingerprints on
To figure out who the fingerprints belonged to, we put Hershey's cocoa powder on them and dusted it off carefully. This resulted in leaving a little bit of powder on the fingerprints.
it. Next, we used tape to print it out on a piece of paper. We scanned it and found it looked similar to Dr. Nicholas Smart's.
Earlier that week, Miss Young claimed that Neff had kidnapped her. The captain interrogated Neff and he broke down immediately.
He said that Dr. Smart had convinced him to help him find and steal the map. Based on Neff's fingerprint, which is whorls out of the 3 types, arches, loops, and whorls, we believe he is guilty.
Based on all the evidence our STEM group has found, we think that Dr. Nicholas Smart and Shipwright Neff are guilty of stealing the ancient map.